Petodo, Eradi, Senya Radina, where farmer Israel and Kama Israel, and Mpom Kabusiama how. Now what to say? Eradi Adome, where your palmy Gidi say, was also a domini biason sunti or 1 year. Medas is what you see over others, a free sabri, a was a sababon on Naibedi upon the home come more. Na ye di atoto to near maybe ye dear boy home. A bray a woman dear minu yin sir and ya bre papa. Ye ka se bremunye a bray dear and ya cry. If it's a COVID-19 therefore be baraman san komu. Near sia man san komu no and no jinawa mononi anke ya. Wa kru ababe pia my ganem hasebi. Nanu ye bun kunta. Se sa kato na bro na nipa henum 500. And a COVID akumo mo ye my gane munko ebasa na yo haw na ya tete anu nti e wo se me no nyina ya fie ho adwen ye yire ye ho ye de ye betimi na ye de aso yare no ano ntem ne a woni nkonsa na okọ na ye timi atrase abo ye bra ye ti hwei enka ye sakete ye bo adoa ne sa na ye sa ne ye dandan ye ho na ye bo ye tri ene ye diskai ye ya abotire the ball na wa hu se eni gie aba ye wa mamre aye kura na ye ntimi nya yi ya si nipa 25 yesu ya tiwe nim se ye nke de dom na ye na nza ye fuhie sei ene ye nya mount days ni se na emrante ne maba etisim na wo mo sa emu asoko ka fefefe covid nti ni nyina aboye utimi engagement wedding don't timi nyo wo ya so a wo modwa chese aye nsem bebre asesa ya brabo ani enu ti a wo se afia ho adwene ye de betimi de so anontem me no kasa sesi e no mienu apa ho sema aduasa enum yi besa sema nwotwe bi aba bese no kroni ena amansan bu nkunta de fa covid-19 ho enipa 108 million 394,000 ena 51 egu achiri ena omanya yare ni bi wo won widiem wonim sa covid yi akum nipa 2 million 380,946 enya asem enya nika amapa ne bra me ne mame bia makwafo e kan kasebo ane ye bu nkonta no na omo de eye critical condition mu no na eye 99,000 ene kakra me no kasa sei 100 solid thousand ene nipa system gwachiri ene omugina mnabofo achi ebasa na ye ya na ye ayemhyehyie na ye hu anopana ne ya kasa South Africa enipa over 1.4 million ena enya bie enipa ewu bro 47,000 e South Africa yen Ghana ha se kura na yen yesusu se ye tribi ye eye kakra ema yen no yen ne kura yesusu se eye kakra ma yen no ana America kire se akakuma ebi na nipa henum ena enya covid-19 ewo oman Ghana mu ye bu nkonta no na omomanya bie 700 600 700 600 ye ba bekinka omomanya nya no fofo omomanya nya fofo na sana ne ye kako enhyen kran ensani kura enu ntina wo same no nyina ye yire yen ho na ye kakra ka ho na ye de so yare no ano efise me no kasa sesi yi enipa 73,557 ena enya covid-19 wo Ghana emu 66,115 ena omo ho atomo yare ekum nipa 494 akakuma bi na nipa henum 500 eti America cho se akato na bro na nipa 500 na covid ekum omo Ghana enye ne papem entime paucho so obesa me da fem ana ma paucho say show nose mask na wo de ka me da fem ma paucho obesa me say na the social distance na ye adwuma me da fom ne the social distance na ye adwuma de aboye ho ban de yare na keka kode eye yen no ata meshi ye mpesa ata ma bekoso ahye enu nti moma yenyere ye ho na yenya kakra enka de ye no ho me babia me ka se nose mask no wo hye babi sa wo hye ne yie say na wo si a handle no wo yi a eno ane se wo yi dia to ba bi twa na wasa maso na de abogro da bio ene wo de yare na to fom na watam de ahye wanum sa na wo pa kire enti na mesre se wo be yi nose mask na hwe ba bia wo de to se wo tissue bi na de be se ba bia de be to no wabu ne yam no ba bia kire wanum no wasi anu trase ama de kire abonte na koso ahwewiem na wadidi ana wanum nsu awiasa atamabo a de papa mua wo so mun sanitize wonsa de ka ho anope doctors need to for stress yento awia kakra ebi mo hon mo madwuma owuram agise onwuna dwo wo mpebre kakra na semedu aduonu bi boapa begina awiam na unya vitamin D no ebi vitamins ahodo no eno ne beboa ama yetimi enya strong immune system e de abo nipadua no ye didie ne nso bibia local eyema yen enkanka yen kontomre ye agushi alefo bokoboko won eyema yen kakaduro jende green pepper eyema yen koko this way nie royal nie watermelon nie eyema yen nyere yen ho carrot kakra na dia soketi num kubensu ebebo yen fefa ne saa nyame adoma odefo be free so na yetimi atrase eni je ne ahodin mu medase me moha me do asese wachu se me mamenda APC as African farmer oya de oya stop on pa APC o ma woni hawo ye what this way chocolate drink o koso fa so kan wonya nso hia ukokra mu ne ye nkoma ne guma hodo mienu baako ye ne Luca Health fo ene ba be di enkomo yi Luca Health for so mo bibi son ko de mayen wo ENT ho yaka ENT ana chese ear nose and throat omo ba se de omo betimi ayede aboa yen wo apomden ho no omo ba kirekire bi mu de kire yen na Luca for de omo te omo nka wa fidie so omo ka brofo eti awiei sei awiei ka wa che na mediye enso so de ayen no just say menum this way kakra na menum de aba be ka Luca brofo enu achi bosumi nyina wonim se ye hwe cancer na no de ne ye hwe cervical afei ye hwe cancer na ene ye be hwe covid ene cancer covid bremu ene cancer ne management and also ne prevention na ya hwe se ekwan ba mu a ya fa cancer adwesuo ne ba ko mema ne de ne ye kan ya che ne ya boroboro so ansa ene asori ma me na ye sponsor sasemra sesia
Peace FM.
Said the obetimi a check na farmer APC nsonti and why ye ne sa akoma.
Uti paiwa fakina farmer akuma APC.
Kaka hawa
akuma APC. Sisiare, what person no mpemu na ye oya. Fever ana wonam ya. Emu bia kina farmer akuma APC ebeye firi ho. Nemum na nuachi na enkwoi dia ko hu doctor kina farmer akuma APC eyema obia ya wadi emfiedunsia 16 years dekro.
Hey, catch it. List ni nie. And you ma beto to dia me baba no hwade no. Hwem so betumi a. Ashew. Now beka. Ya John to mami ensa duku portmanteau. This way chocolate drink. Na kan wo hwe afibia so beri ni waware ne a. This way chocolate drink. Na kan sia. Ashew. Udan kwanu tumu ho. Me be mo anu nsu hye kura dia ka ho. Uhade a wapi ho. Ukasa batete eda fom ho.
this way chocolate drink.
Kracha obepa e baba aware.
Ashew.
Ye fi say this way chocolate drink ya sorry anopa no ne yenom ye be chef fridge nom no se snack ye nya hoho a no ne de serve wo mo ye didi wie ne ye pe bibia bogu ya de so a this way chocolate drink ne yenom and this way no ti ano a he se kire wom koko wom brick wom bibia wom ade wo hia ne so hye
This way chocolate drink.
de wo hia ani so hye
FDA ahwe se adwede nkratoe mo agye atum se eye Many be Bennett and Andre, I would have been out in Kwama, I would have pay saying a couple who shut the mouth. Many and Sewa and Mpom Te Sen 2 year draw down Suman Polyclinic. May an NTS or Papa na or say to 2 Jan 12 for any or with Jamasia to. Yo, Namini. Bafuan so many NTS and Yambo China and na or Papa na watch Dawudi or Amasaman I kind of blow. Ema ni unuanum nyina shedding. Nipa 25 na watch that day. Rade ncheche uni abusuani nyina re. Gospel all stars in yeti. Okay, medin pa bo amane se ene yen komo no egumu mienu baako ye ni Luca Health Medical Speciality Center anas Luca Health for na eba aba betwetwe ene awie wo mo pese nimdie bia wo mo wo ewo ENT, ear nose and throat ho no wo mo ne ye che enti Luca for wo mo wa adokota for no dodo no aya abrofo enti na awie wo mama me broni ba baako wo doctor your friend Dr. Jeanette, you Beckshot. Dr. Jeanette Beckshot. Doc, good afternoon.
Good afternoon.
How are you?
I'm fine, thank you. How are you?
I'm good. From which country?
I'm coming from Germany original.
Oh, okay. So, European.
European, yes.
You are in Ghana.
I'm in Ghana.
Just to take care of Ghanaians.
Pardon?
Just to take care of Ghanaians' health.
Yes.
Welcome.
Thank you so much. It's a pleasure to be here. Thank you for having me.
Most welcome. How is Luca Health?
Luca Health is a multiple specialty center. We have a beautiful new clinic in East Legon, and we have different verticals. So we can treat patients' conditions for internal medicine, for surgery, for urology, for ENT, for example.
So it's like you have every condition.
We treat, so for example, for ENT, I can treat all the conditions, acute disease and also chronic disease.
Okay.
If necessary, we can do also surgeries in our nice, beautiful new operation theater.
Wow. So does ear, nose, and throat conditions degenerate to the point that a person will need a surgery?
Sometimes, yes. Sometimes you have just an acute infection, like for example the flu, like the cold, like a tonsil infection, or a hoarseness voice for a short time, and it just solves with a little bit of medicine, which is given by the ENT doctor after examination to the patient. But sometimes you also need and require surgery to get better.
Now tell us more about your ENT services at Luca Health.
ENT means that I treat conditions and patients for ears, nose, and throat. Ears, for example, when you have what's happening here quite often, an itchy ear, ear running, middle ear conditions, or hearing loss even. Nose, for example, when you have an acute blocked nose or chronic blocked nose, a runny nose, sneezing a lot, or difficulties breathing. And throat can be related to the tonsils, can be related to the deeper part of the throat, to the vocal cords, can even be related to having some problems with the stomach, like reflux and acid is coming up in the stomach. Or sometimes patients who are snoring a lot. Also, these kind of patients are treated by the ENT doctor.
Okay, assuming someone comes to Luca with E, that is the ear, the nose, or a throat problem.
Yes.
Anybody with any sign of ENT can visit Luca.
Yes.
In recent times, because of COVID-19, the moment someone sneezes, you become a nuisance to people around you.
I know.
Yes. So someone who most of the time sneeze.
Yes.
Or who mostly cough.
Yes.
What help do you offer that person?
So first of all, you need to divide. If you have an acute problem with acute sneezing and coughing, then perhaps you just have a flu, for example, or a normal cough. If you have chronic problems like sneezing a lot, coughing, itchy throat, itchy nose, itchy ears, all this is often related together, then you might have an allergy, for example. And then you're also very good, the advice is also very good to see me as an ENT doctor to make the diagnosis and to help you to find out what kind of allergy you have, for example, for dust mites or for moles, and then help you to treat the condition.
Interesting. Assuming someone snores.
Snoring, yes.
Yes. Mostly we sometimes say the person is obese or the person may be having breathing condition. That's why the person is snoring. Is it always the case, or through your work you detect anything different?
There are some things which needs to be discussed with the patient. For example, if you have difficulties breathing during daytime and during nighttime, then perhaps you have a structure problem in your nose. For example, a twisted nasal septum, this is a wall in the nose, or your nasal turbinates, a small tissue in your nose, is enlarged and too big that you can breathe normal. And this requires, or then I can help you with a small surgery, for example. If you have if the problem is more the snoring during nighttime, then we have to find out if the patient is just snoring, or sometimes they even can stop breathing and then suddenly breathe in very loudly, and the bed partners, most of the time the wife or the husband, is very anxious about her partner, and then the patients come to the ENT doctor to find out if it's just normal snoring or if we have another problem.
Assuming mine is not a normal snoring,
Yes.
How can you help me?
I would do an examination of, first of all, I would ask you first what the symptoms are and find out a little bit more, like if you're also sneezing or if you have a runny nose in the front or in the back. And then I do an examination. First, I check your nose with a microscope. And then later on, I need a small flexible light in your nose. It calls an endoscope. And with this endoscope, I can see very detailed the structure of your nose. If something is blocking the nose, like the twisted nasal septum, which I mentioned before, or if we have, for example, nasal polyps, or even tumors which are blocking the nose and make you some trouble during nighttime or during daytime to breathe.
You mentioned endoscope. Is it different from the normal or the usual one that we know we use to detect diabetes or any other chronic disease within the tummy? Endoscopy is either ulcers, cancers, or I don't even know whether it can detect cancer, but for ulcers, we know endoscopy does. This endoscope, is it different from endoscopy or it's similar?
So my endoscope is a very, very thin one.
Okay.
And
not the uncomfortable one.
No, it's itchy a little bit.
Okay.
It's itchy a little bit, and you can feel that I'm putting something in the nose. But my patients always say it's much less discomfort than having a COVID test done.
Oh, really?
Yes.
Less discomfort than a COVID test?
Less discomfort, yes. It's just a little bit itchy because it's more... it's not a brush, it's just a small light which is going into your nose. The examination can be done in the office during the same visit when you see me. So you don't have to come back for the endoscopy. It's done everything is done during one visit. And then I can see what the problem is in your nose, and we can discuss the next step of the treatment.
That makes treatment simple. Same day you can start something.
Yes. most of the time. Sometimes when you find, for example, nasal polyps, then you need also to send the patient to an X-ray to have more information what's going on in the sinuses, for example, where the nasal polyps are coming from. And then you can discuss with the patient if medication can help, for example, or if we need to have a surgery.
Most of the time, the ear, the nose, and the throat, we work on them together, mostly.
True.
How close are they related? Are conditions from the nose sometimes, does it affect the ear or the throat in any way?
Yes, this is possible. When you have, for example, a blocked nose, the nasal passage is going into the nasopharynx. This is the area behind the nose. And then it continues to go back down in the throat and into the direction of the stomach. So, for example, you have a blocked nose and there's a lot of tissue swelling because allergy or nasal polyps. Then it can affect your ears because the ears are connected through a very small thin tube into the nasopharynx. This is, for example, for children very important because children who has enlarged adenoids, this is lymphatic tissue which is sitting in the back of the nose. It makes the children very uncomfortable to breathe, so they have the mouth open all the time, they have a runny nose, sometimes they have recurrent ear infection, and this is related to the tissue which is sitting behind the nose and blocking the small channel between the nose and the ears. And then also you can have some fluid behind the eardrums. The children cannot hear very good, have difficulty to learn speech, and all this thing is connected together.
Okay. Talking about children,
Yes.
do you have specialized childcare department at Luca, especially when it gets to ENT?
I treat all children and adults.
Oh,
So
okay.
my youngest patient has been a few hours, and my oldest patient was over 100.
Your youngest few hours?
Yes.
In recent times, studies have shown that some of our kids who have speech
Yes.
issues or hearing impediments, there are things or parts of their system wasn't developed well, or there were challenges.
Yes.
And we heard if you see it early, you can rectify it. And if the child was to lose his speaking ability or hearing ability, we can rectify it. Is that true?
So first of all, you need to know what the problem is.
Okay.
So you need to have a very specific examination and history of the child from the parents. It depends also how old the child is, what you see. For example, when I see a child age of 3-4 years who has spoken before, but the speech is suddenly getting less and not clear anymore, then often we have the problem somewhere in the middle ear with fluid behind the eardrum, which can be treated very easily. And sometimes it's also related to the enlarged adenoids. But if we are talking about children who has difficulties hearing since birth, then you have to make different examination and different hearing tests to find out if the children can hear or not, to give them the adequate treatment.
Whenever we mention surgery,
Yes.
and it's in line with anything up there, the head, we get scared.
Yes.
How comfortable or discomfortable is surgery or treatment within that part of the body organ?
I think the most important thing is to talk first, to explain what I'm going to do, why I do have to do it, and how I'm doing it. Because if you know what's going on, then it's much, much more easier for you. You are prepared and you know, okay, for example, when I clean the ear, I use a small suction tube to clean the ear. I do use the microscope to have the best vision. I'm very careful with the ear suction tube. And you know, it's just a little bit of noise and a funny feeling. This is easy to explain you, but if I just do something and you have no idea, then you're scared. The same for surgery. Surgery itself, nobody would like to have surgery. Me neither, so I don't like having surgeries at all. But if it's really necessary, it's really important to explain the patient what's going on, what they have, what the condition is, how the treatment is, and what they have to expect during or after the treatment. Surgery in ENT is mostly done under general anesthesia. So this means we put the patient asleep, and during his sleep, I do my work. For example, I do an endoscopy or an endoscopic surgery of the nose, or I do some surgery of the throat or of the ears. And when the patient wakes up, most of the time they don't have much pain. And we are in specialty centers. Our patients leave the same day with less pain. We don't have big cuts in the face, so I don't have any cuts in the face, for example. I just do the surgery through the nose, nostril, or to the ear channel if necessary. But even for my colleagues, they do surgeries with very limited cuts, that the patient is able to stand up the same day, walk the same day, and can leave home the same day with less pain and less problem to do her own or their normal day work.
Treatment, whether by surgery or non-surgery, is done here in Ghana.
Pardon?
Treatment,
yes.
Whether you have to do surgery or not, the treatment is done here in Ghana, or
yes,
you refer the person outside.
No. We do surgeries in our facility. We have a new state-of-the-art OR. He's well equipped, and we can do surgeries in our clinic.
Okay. Wrapping up, I want to ask a bit about breathing. Once we do ENT, everything breathing to, I know you usually work on. How many seconds should one be able to hold his or her breath, especially breathing in? Like breathe in, out. How many seconds should one be able to hold in his or her breath?
This is a really difficult question. Everybody is trained to breathe. There are people who holding their breath very long time. And as long as you don't have any asthmatic problems, which is treated by the lung specialty, which I am not, then it's normal. There's a very big variety.
But still, you have lung specialists there.
We have an internal medicine specialist and a nephrologist in our hospital, and he's taking care of the lungs of the patients.
So you have variety of specialists.
We have internal medicine and nephrology. We have OBGYN for the woman. We have surgery and urology and ENT.
If some of our listeners want to contact Luca Hospital,
yes,
how do they go about it?
So you can reach us easy by phone. This would be the phone number 0544120777. And we are located in the Massery Road 27 in East Legon on the MDS Lancet premises.
Okay. Thank you very much for your time this afternoon.
Thank you very much for having me here. It was really a pleasure talking to you.
Nice meeting you too. I was on for na kodi brofo ye Luca for kan bibi fa ENT ho na samne tintin ni ti ane se ya home mu baby ya home fa baby eti asem fa baby edidi fa o how bia ba se Luca Health for no e wanimdifo ya maami doctor yi ye ni free German en waba ye obehwe boa ye ho ade se wo se ye surgery mpo a wo ye ni nyina wo ha sei Luca Health for East Legon Lagos Avenue ho na abehu omo number boy is 0544 120 777 0544 120 777 ewie ye ne Dr. Jeanette Beckshat ya wo free Luca Health and free nkomo no ase ye dane ye ho ye ba ababehwe cancer.
Thank you, Jesus.
Yada evangelist Ernest Ado ene mami biama kwafo ase womo ene na yete ye yedija Luca for ekwan baby adu se bosome mu nyina ye hwe cancer na last week Dr. Mrs. Beatrice afia de na me share post bi na me ra ho onza covid ne ba ye no ye bibia ye covid so wo hwe yi kra me sign on that be a sign on I dedicate 5 minutes of my time be a member radio so apart from news because me a health advocate yeah they can't COVID ho asem but COVID the beba besna ko and now COVID yeah the ani besi no nko aso ama cancer diabetes hypertension ulcer ENT e kan ye ene de kan ho akum nkrofo for the fear of COVID eti kenje bi ye be kan bi na ye je bi awiai afi nyina me hu no obi anka me nuanu no anka me ntifi krum so afi ba bi afi adu me hu no ene nyame adom nyame na hu mbobo ene waba Dr. Edu Boateng one ne Dr. Mpom da End Point Homeopathic Clinic no Dr. ne ye ba beche bibia cancer oni official pa o
onyame je osu
na ne Mpom Te Sen
afenko me ho ye pa
abusafo ho ye
nyankopon adaroma
ma men cancer na sere be 2 weeks ago me your life on say nwura na me your life for talk life me your life for am say Dr. Said animni anam si rade papa we wo ti we wo Facebook ba so ko he du Boateng ba bia Facebook wo kura wonim ho wo nam Facebook ana me se me chia wo no asama me emoji ana me se kai
Or just when you WhatsApp.
When I'm cast, I have blood. This is me James, son, and me James. Oh, I go gonna sound.
Hey, that's a good one.
Where sound? What? Anyway,
it's just a number.
A number.
On the
moment, my age, I number powers, Abapano. What my age, I am number. Papa, say, ah, when your friends are cocraning cry. Or no, or Bayer was up.
Yeah.
Facebook, how on my. Now, about Facebook Live, now I say, ah. Like seriously,
that's right.
Doctor Heidi pa. Anyway, akwa baby.
Meje also pa, we chia otiefo nyina so. Me mo nyina so afisia pa.
Afem ko mechi.
Afi de ye momoden ase ye behwe ho yie. Na said the COVID no air rise no. Ye take your own destiny in arms. Na ye mo ye ho ban. Ye say wo ti ase a na wo ade. So nipa unya wi a na bibi a plans a woni bibia no. It has come to a halt. Enti no ye be che Ghana fo nyina say mom nyina ye mo boa ye ho na abrabo no ye nyina no enko yie ma ye.
Yo, ye da se. Doctor Fei wa ma ye general futu. Ye te cancer ho asem ye kan ho asem.
That's right.
Eti ye cancer in general. Anything.
Yo nana, me da se ye ka se cancer. Twi mu no ye beka se kokram. Cancer no ni twi mu no ene ye kan se kokram no. Na ye ka se na se kire no ene se enipa de sani nansa no de ye see the basic unit of every living thing. Ana human being no is called a cell. It is cell no a group of cells e ka bom na abeda no bibia fe tissues. Na tissues no group of tissues na no so aka bom. Na beda na bibia be fe say organs. Na a group of organs eso so kabo mu wi a eno so be kan say system. So ho eno ntino na say the basic into the can say the basic unit the nipa de say ni bia no. De ye you can the basic na say de ye
ekuma kra.
De kuma kra wo mu no. Ene ade fe say cells no. Na cells na wo hunam dua ni mu no. Na de asie ni cells ni bi wo within 3 days 4 days if you have 2 weeks it has to die off. Sa cells no a e wo ho no enipa de sani mfansa say cells no a e make up the ni kuma akura no a e woni ba de honam dua no honam organ ne ba bia no e bi wo ho a wo hwe colon cells for instance within 3 to 4 days no ewu e die off na foforo ababisi anan sana etie. Now the ACN say so be obetmanya bia fense kokorama na say cancer no. Na say the cells no are in that organ no. Time I say ewu no, enwu. The cells are not dying.
Mebo. Cell nipeduano your cells.
That's right.
As and your tissue
organs systems.
Any
Yes.
systems.
Correct.
Cells no and the minute.
The minute cry.
Kete no. And now, no, averagely, it be 3-4 days.
14 days.
3 days, I could see 2 weeks. I brought so much money in the
correct.
Now, what's a cells, maybe a hundred more. A real judgment.
Now for us, I'll be replacing.
Now for very replaced.
Yes, and the cells, no, once here, it will be new ones are replaced.
Okay.
Now, the SCN say, Obi Ohana the cells, no. So obi benya kokram no a na say cells no a what that organ mu no time no a aso se ewu no enwu.
Okay.
Na emo no enwu no enwu ni nti no bo se na multiply and never can say at uncontrollable rate. Na just say said the number of cells na what's that organ mu no because the nipa de tani nyina no we are made up of about trillions of cells in the whole body. Now, sek that part of the body na enwu me fancy ade ne ye baako ene nka enwu a na sa ade no multiply 2 3 4 5 within a short what you say na multiply no at uncontrollable untimi control no na de ye say surrounding organs and tissues. Na just say it is obi ka so obi anya kan kokram no a enye sa honam dua no part no nko a na enya na emomo no surrounding organs ni nyina no ehon to chema. And until me fancy you can be a cervical cancer. Service no, and then kakokram ababetomu. Nanso so no, it me affect our dear no. that is uterus na womb no etimi sa affect fallopian tubes etimi affect ovaries no etimi affect sebi obi ne vagina kona na say ne vulva no etimi affect any part na etimi affect bone kura so etimi affect o blood no enyina eti say de ehu ne say se obi nya bibi ti say infa say obi enya yade bi ti say diabetes ana obi o eye problem no sebi wani kura na efira wani nko na efira organ nko na ahwato chema obi wo yamkuro no o yam no nko na ekuro ababeto ho emeto enkoto ba ebiem what you say nemu no se yakase kokoram a
cancer dia
enye organ nko a aye cancer so no na enya ene tu yemu akokoram no yemu ahodo bebre na wo hwe ewiase nyina before mekoso kra no wo ewiase de mani eye hunkura kese ne se eduru busumi ya ye ka ho nsem kese pa na a ye dimu ne se wo ewiase nyina cancer cases ye wo ewiase nyina no ye hwe the sub cancer cases wo ewiase nyina no a na e mu be 100 types of cancers. Let's just say you were 5 main types. Name after the main types, you know, you other forms of cancers. Yeah, more than 100 type of cancers. So now we are seeing now. Ya di anki esi ekum we are say ekum nipa we are seeing now. Sa kokram anase cancer no. Nana the second leading cause of deaths. Second leading cause of death in the whole world. So let's say ye accident free ho malaria ye yade bia ye say ye nyina de kan nyina bomu statistically no cancer kokram no yade a ekum nipa ye hwe de wias de ekum nipa pa no a de to so mienu sa de fense cancer no enti ye kase cancer wasam a na de me pa nyina no say enye organ no nko a cancer no aye dai ato no ena cancer no etimi dai etimi enye ba bia cancer na bedru no nko a ene etimi dai etimi de ba
ebeto ha baby e ben ho bia wotimi trete
etimi na yim ko etimi ta ye kan say
na kwabam no ansa wo trete
ne mpi anything na obi nya cancer nana say do the first stage of cancer. In fact wo sika betumi da ko in fact hospital bia what e wo ba bia wo twumutan within bia be 6 months abro so 2 years there. That's the way they why nyame dey.
Odobeko.
Yes.
What treko? I said the kerosene.
Agu ha say na air spread and sa pepe na cancer tie. Anything na mana e ma na ehu no because yade ba ko a enye se bia obi anya yade bi o se obi anya diabetes. O pancreas na ehu amane na bia o sugar no e de e kosoro. Enko say other organs bia. But we dey na dey organs ni nyina no. E make sure say the burn no e di kan invade baby ben no na say moja no na say bone until within a short time no na breaking the human event say body mechanism no and body control mechanism na breaking it down. Let's say immune system ni breaking it down na otwo mutan obeko enti e ka say cancer dia na ya dia Ghana fo ni kwa say e dey ye fa de tra e ya dia e hu kese na no sa ya dia we say ni nim say wo ye sikani o say ka first mere bi atwa mu no e na ye ka say obi oti ya dia bi say diabetes pressure so wo je te sa ya de ni din a na wo dwen say oh we de ene obi a obo bere bi akokodu mpempen so obi na you be shocked to say obi ho ade ode beto sebi aduro kra no nkura aduro kra no ko wonya e che say nipa de sani no ona na sa ya de we nyina e wo no enti cancer is just emfa ho ene wo tibia ene emfa ho ene sabi status in life obia etimi dey etimi nya sai ni bi
abuzafo enti na ye hwa cancer e fa ye drusi cancer ho komo na yedi eti kane no ya tia bro e ye nwum obi boy yes na wo yes so cancer ya te ye ba be hwe no na dwesio no mu na watimi ato niema bi ase e wo abrabo mu ene onipadua mu ene watimi aso ano ntem ye ne Dr. Duwati na edi sa enkomo yi me ba sesia ane yesu ni na sempa no mini hwe kora wase no de oh minya abza no Dr. Dubois na gusu di enkomo na e fa edubons we ni nose mask na ha adwen ono kwa na wo studio bi ho enti wase wotimi yi no nya ne freedom because ono kwa etimo nti ase esa mai do ka fe ye mehwe se hu se cells bibi ko teche makr na nya na dwuma se de wose ye ankota me wose kwa ye wo problem maybe say should focus on prostate but before I bedru ho no ni pedua na kwa ne fa hini bi na cancer timito because your liver cancer kidney stomach breast ni pedua na kwa ben se bi e betimi ay cancerous
yo meda sepa cancer no nana se de osi kaka ya yen sheda honam dua na kwa we be bia cancer timito honam dua na kwa we be bia ye wonti ye will be a skin cancer mpo ubetima nya brain cancer betima ba kokran betima ba mu ana e be kan say tumor on say we cancer na no a na your 5 main types na types no ni bi ne kan say ba the first type ne fa say carcinoma eno ye one of the types you be be kan say sarcoma eno so ho and you be be kan say melanoma eno so ye one of the types of cancers and you be be kan say lymphoma and leukemia so ho eti empebebre no ano cancer ne bi wo ha se de ne bobrenzitie no obi wo cancer ne ba etimi beda ne bibia fese tumor enye cancer nyina so ene ede eda ne bibia fese tumor ena say the eda ne tumor no kra no so ne omu two main types aye be kan say benign type of tumor ene obi be kan say malignant so na say kwa malignant no a na say no de ehu kese pa benign no empebebre no ano cancer etimba benign no ya na enye cancer en spread it eno no enye ade ehu bebre enye ehu na mo baba ye malignant ya kasa malignant ya and with all these types amabobodin sarcoma carcinoma lymphoma melanoma and then bibia be say leukemia no uja ni nyina mu a ni nyina mu so no ewo there were various types so under them no hwe mu a ye obe 100 types of the various cancer identified ones no eno no kran che say eno ne identified de ehunu de ehu ye kura no de yentimi fan kasam eno no so de yetimi affect any part of the body now hwa ye wa about 79 organs in the body 79 organs in the body now out of these 79 organs no nana ba bia ni wa cancer ntimi nto eti cancer no cancer din yenya din no e free the type ba bia organ kro no a cancer no aide ababeto ana ba bi kro no se free moja mu a e wodi e betimi ama no
se beto leukemia
that's right e beto no fu mu a e wodi ama no breast cancer e beto bia skin na bia skin cancer e beto prostate mu a prostate cancer cervix ya cervical cancer stomach ya stomach cancer eti empebebre
ohini mu so a throat cancer
so I say eti edino a eba no ya peke edino from the organ no anaba bi krono a at the chrono ide enya organ kwa na betima because you are more than 100 now more than 100 you are about 79 organs what I say you are about 79 organs e wo nipa de sani bia no and you are about 11 systems e wo hunam duanim say organ no so enti eno ne ade a e wo ho na de omkase ne say edino is coined from organs ne anase baby chrono as ade no aide efiri aba no and enya say edin no aide efiri so namom the most common type no you can say the most common type of cancer no and I'm probably yetini din prostate cancer let's say the cancer common no let's say the air fatigue ewiase and nipa do no ano eno ne ade a nyina no ya na ebo ho dawuru bebi ti say bia be can say bia prostate cancer yes obi your cervical cancer breast cancer eno doesn't mean say any other kinds of cancer and any other type of cancer we are say nemo de ohwemu a echi nipa bebre mema ne ma bebre pa no ene sa cancer no ampe bebre no na do this day no a na bonsa doctor for boss ade ebo ho dawuru kese pa na nya sa so de a say this kind your different types of cancer we are say
it's a different type of cancers na e wono ene ne ye ba be hwe prostate ye ba be hwe prostate enti emema ne nyina munyina hey emma no so mo na mo feedi wo mo me ka da bia sasa wo ye madam na wo fie woni oba wo fie wo fiefo wo mo health wo ma hoden ejina wo so woni managers e wo fie ho ensu efie ho for benom no you are in charge wo maduane you are in charge ahonidie you are in charge eti so be ma no wase na wa na so den sa mampam na ye okọ hospital ne ma na dure na onnom a sweetheart when I was so use gumption so ba mistress madam papa managers now finding ways and means a drone back on the system Pedro nom na say COVID buy you almost thrown tea and a concussion but drunk sanka ne ko the far pet or the best betes but madam who was share e wo memma e ko ma ye bedie ye to aso mu fi say na ho odin fiwo ne nkwa emu nyina so wo ho ene wo etientie ne derive strategies a ye de bebo amema no be da se watemase e agreement am ne menuan mo ma ne ko om de om temase sa doc ya ka prostate cancer say ye hu cancer bosse ene ye gina ye nka prostate disorder prostate cancer it's what aroma fire fem
okay you made us pa pembe die kase prostate no eye badwa ana yebeka ne se walnut buni beka se eye walnut in shape ana se yebeka se donut that is said the shape of the prostate no answer no that is how it is a shape it is a donut ya yedia now its location no be bia prostate no answer no ewo no ewo in between obi enipa da sani bema o bladder no eye odun so twaye no ene se bi obema no eye o penis no in between no sa gap in between no that is where the prostate gland is located no na urethra yaka say urethra no a ekwan ada obema bia bema mu no ai odwonso a Johnson nefa eba abonten ana woni oba kura hia wona na yiri hia nsuo nifa ho no eba no ho ne beka say urethra na urethra no pass through bibia fence or penis ni mu akosi o bladder ni mu na pass through say outside the urethra no in between onipa da sani o bladder and o penis wo no ho na prostate no wo nti wo hwemu pa no scientifically no there's a urethra no pass through bibia beka no say prostate gland ni mu ne dwumadie pa kese a edie ni dia ye ne se enipa da sani no bema and the propel let's say a Kenya she Johnson esoma Johnson eba 14 enitina na obo se isusu no ana bibia kan wa bia ni system ni mu no se wo se we free school
na we are branch na ya koda o nyina hwe
se free school ni e ba enam say that time prostate ni very strong ni ntino bo se otimi gina dan ho obi empentin dan na say bia dan ya mpem bebiri no ano yem plaster ye kra no bo se watobu ano wato block na otim e ho ne gina yetimi de yetim Johnson no otimi de twa etimi de draw card a cho beto e dan ya da cho besi
no de atro
de adro ni nyina just say ahodin e propelling Johnson no e to bitimi Johnson a otimi pega ne bema ni se ni wa Johnson a wa hwe ka na begu na pampam so hu let us that time no prostate no very strong enti no na etimi mani pa se ni Johnson no e ba 14 ade ba ko esa ye ne se bema bia no hunsuo no a eba no apart from say the beka say spermatozoa I free o testis ni mu no de eba no de ma sperm no edi mu kese pa e bema bia mu no prostate ni produce sa de no eti beka say the nutritional part and the nutritional value of the sperm no prostate ni produce sa de no eti ensuo sa ensuo ne ma sperm ni di mu na sa ensuo no nana de ye die ensuo no na ma bema sperm no because sperm no ayese konkonti ma moawa ebetma kan se moawa anase enne ebedani nipa de sani eti sperm no nidi baabi a ehia medium to ebetimi ayde ebetimi asuimi afiri oba na se a akọ bibia efense fallopian tube na committee oba ne kosua no empebebere no ano sperm anti ebetimi o sperm no betimi asuimi a prostate no nutrient na prostate no anase discharge no a free prostate ni mu no ena masa sperm no de etimi esuemi ne dwumadie ba akoso so pa no ena sa bo sperm no ho ban Emma sperm no entimi emwawa no ana de ebeda ni nipa de sani entimi enwuo e kwan so because be bi ho a the sperm no etimi di be 72 hours e wo ba mu obi de etimi di 48 hours obi de etimi di 24 hours e de enti ebe emma ni nwuo emwawa no wo ho ana konkonti ma no wo ana spermatozoa no wo emma ni nwuo no eye because of the prostate no de inso no a discharge no and the protect nipa de sani ohunsuo so eti when the dwuma de kese pa ne ye ka se kokrama ba beto sa prostate ni mu a na che se the cells no a making up the prostate no organ cells no a make up the organ no ansa no na che se ayedai engu entimi ngu biem o se ka etimi die off na new ones na are replaced ni be sani no all our cells no die off na new ones are replaced die off anyone when entimi die off na entimi die off no na multiply at uncontrollable rate ya say surrounding organs bi ti say o bladder no say no tissue fancy urethra no say no na obu akwa say the kidney say the moja say the bones enyina eti aka say prostate cancer no a kokramato ayimu no a na che say nana ye na se kire nyina na say kokrama atop prostate ni mu a say surrounding organs nyina so eti eno ne ye ka say prostate cancer na se kire no
Yenim say prostate no gland no.
That's right.
Ewo the function say the watch yi or how ba ho a before or how be ba ebekwa kodru cancer no. Per de wuche de na a long process enya one day process.
That's right.
Enti in between strong prostate ekokosi cancerous stage no. If you wanna dey na koso
yo da na meda se pa empa bebre no ano ya kasa cancer no a ida se wodie no eye normal ana se enye normal but of course ya na bebre no ano adwen ye o mo se ye wo different types of prostate problems ye wo bibia be kasa bia prostatitis eno no wo ho ye bibia be kasa bibia kasa prostate abscess eno no wo ho ene wo prostate enlargement but ana any of these prostate problem no entimi en lead to bibia be kasa cancer. It can't. A different problem altogether because we more prostatitis no normal dey ba na infections bia bacteria bia non-sexually bacteria or non-sexual bacteria and as obi okwa no a namu ene e bit ma dey apekis ade no free and that is no prostate na inflamed ene obi o because prostate enlargement so prostate na nza no ne kese no dey am ne kese no aye bigger than the normal size. And the because abscess and also no, you because it be abobon pomponya, opposite no bon pomponya, and because it be on abscess. Now the young say, Bebre no, see a casse prostate cancer no, and yet ne enlargement no, and answer prostatitis no, and now prostate abscess no, and they lead to that no. The most prostate na shall say cancer so no, you're about 4 stages. You're stage 1, stage 2, stage 3, stage 4. Say stage 1 no a ene be kan de na che say e on germinal stage and e be ka say embryonic stage so na che say no de e easy to be able to reverse the cancer no na say nyakran spreading ko other organs no by stage 2 no na say say again momentum na say spread it by 3 no na spread na say say other organs it by stage 4 no and then one win year na eno de ya for new hospital ntama na you can't live with just say enyadu emergency situation so eti ida say we normal na wo sha say wo kwa yi no so de it take time and na bon so bu anu asase say wonya science bi obi so ha ya na de ehun kase say bebre no na ya de aba bebre no ano ye be ka say asymptomatic wo hwe say covid-19 kura ba yi na da no science no but in fact, some of us have seen a lot of these COVID-19 patients here. Nana, nothing. Okona dwuma ye bibia obecha kenwa beba no abun se bia nipa no wanya saade. Na se ene yade bia no ba nana edane na ho. Eye COVID-19 pe. Yade bia dane na ho. So hu eninti no ebi betima nya yade bi na eyi ne ho san bi. Obi so betima nya sa prostate cancer no na anyi san bia. Ene na dangerous no because enya do stage 1 no na se da ne ho adi a kire wa easy say nipa de say ni betwa ka say based on the me hunu ninti no ma me rushing ko ayarasa bia na no wadi ankere wa from 1 to 3 1 to 2 to 3 4 bo answer yes obeko hospital say wanya cancer ana post kokra weto ni prostate nim na wa hwe ana ede ne ko e ade a wo wiase nyina no a memma kokra me ade eku memma wo wiase nyina no e na the leading cause
na no na me ne me mamba wa edi nko na make say covid ba ye asymptomatic ne entanka enya de e wo ye dictionary covid ba ye na aba be yi na peer free health kasa emu na anya hwe no enkanka new variant we amayen ehu say you need routine check.
That's right. Very important.
Nipediana kwa ni nyina.
That's right.
Eti before bedru stage 4 no. So your routine check up e bia stage 1 ubetimi ehu. Stage 2 emfa nko
do that stage. Okay. Yeah.
Ebra wo ye analogy dia fa prostate ye strong. Twi ni no ho no. What dem kwada no memu ano. From says hona says falling in the chroda.
That's right.
If he says na kokosi 14 15 ni say oh boa. Obo pon school ah. Sabe oyi na de emu nkwada de ne mpani de na kwada de draw. Or the bed draw bia de hwema ne so so no de be call round that. E bi di chiro mudi.
No correct.
Enti meye openi. Na me hu se meye at risk. Enkwada enhyeda enni sa problem no stage ben ana me hyase enka say me ko hu Dr. Duboati na me kwa me routine check na say me ko share me organs doc ya prostate ka ho na wo de ye full check na me hu say age ben ye focus on prostate
yo na me da say a very important question pa empe bebire no ano se wo ka with all prostate problem age bia betimanya bi te say wo hwe bi say prostatitis prostate abscess enkola akora betimanya saade no akora nya infection obi ko urina na se ebia obi adwonso aguso na se ebia ona kono infection bi wono so a akora kotena so a obetimanya saade ntina bon se anase ye enkola ye timi kodwale nsuum dwonso ya yaw ye beka se bilharzia utimi kodwale na bia akopeke bon so dwonso a moja ifiri be manu ba na moja bi wa itimi ban say in the form of a clot obi okwa bon say obi wo ha obeba hospital no moja ifiri be manu be to form no te say wa mo awon sa twede e ba no boom na ba be to form ni nyina no eye emo abani bi eno no e de enye no ne ho asem ne ye kenye eno no nye cancer eno no can be infection ti ye prostatitis any prostate abscess no a enkola kora timi ye de obi a timi empanyifo timi nya enkola so ye de etiminya na ye koka bibia be kan say enlargement ne cancer na de a empem bebire no ano omo a omo tanya no eye omo mfie no aduru animu kakra in fact from there 35 years 38 40 50 o chances no nti say obi o be 35 years na chance ye be 10% ya obenya be 40 years na o chance e bia be 20% obi o be 50 years na de no bia ko be 30 or 40% it the more wo nyini no na eno so no amount risk no of getting either the cancer no or the enlargement no na eno no extremely high the anti number ema ne basa the ema ne basa na na ebema ye produce two main hormones so bibu ha fence testosterone and bibu also ha fence estrogen na the sie ni se bema we are young no a you produce high testosterone. Na just say wo hwe testosterone no a wo de confidie mu pese wo check hormone no e hwe testosterone no wo de confidie mu a be ma na betima produce be 90% of the testosterone. Wo de wo check estrogen no a wo betima produce be 10%. And intino bo say be ma ye wo ye young a wo sexual in fact say be ma ni o mani humusu a ana wo get erection wo get erected there na wo say ahode no e very strong. And on the course sa de no and the course sa strength in bemamu no edinti na bonso obi wa ye young no a se bi wa wale mpokra no a se de otimi ne yiri hiesia no after certain time no bonso na sha se slow down because wunyini na de esie de so se wunyini no na estrogen level no na rise estrogen level na be 10% no na afei eno no rise 20% na rise no na testosterone level no so no ba form And until we rise equal 20, estrogen rise equal 20%. Yeah, testosterone reduces to 80%. A crop estrogen no move to be 30%. No, testosterone moves to 70%. When I rise equal 40%. No, na estrogen no, testosterone no, every job about 60%. It no, a rise no estrogen level no, scientifically no, approve actually say, who produce high estrogen level no, and promote the growth of prostate problems. The growth no and into where organ be a we as no anybody say ni no organ na wo be ma ho a be ma nyini no na ni so nyini no e ye bibia fancy prostate gland if you say wo nyini no a wo nyini bia automatically no wo nyini no estrogen level will rise, testosterone level will reduce. Na estrogen level will rise no na promote the growth of the prostate gland. And into him and in Tina Bones will be a cancer, prostate cancer biano. Minya will be all less than 35 years here when your prostate cancer would die. Minya will be now. I had a lot of research about this. Minya will be so sebi nya young kwan is a prostate yade ubisa urologist or mom share prostate mu how nyina no a obi na wait my record side usually no say 40 years 38 years 50 years 60 years 70 years for no and the 10 years side is because of the hormonal imbalance that take place with respect to testosterone and estrogen, you know, and the disadi and eba. And inti me akwala intimi nya ade be kan say prostate cancer or enlargement. This will be our day when you because of the hormonal changes now it take place now.
Dicey kakra.
That's right.
Apart from asymptomatic issues yenim said na your common signs ebe mu who say baby a megina me free prostate disorder me call cancer ana me wo how e betimi aye metim signs ni be ne de hin
you know na me da se pa de kese ne say sometimes we e be ma a difficult to know say signs ya minyan say ye cancerous say ye enlargement say ye prostatitis no very difficult for dicey. Just say, in fact, Dr. Kura ntimi obetuma suspect say obia by your age, you know, it's likely say bia me hwewa ebia wo be 40 years and over me hwe prostate science na wunya no a me suspect say bia enlargement to na bibi but ontimi nye de entimi nye specific en kan kire wo sa de no da ono ontimi kan kire say cancerous me kwa wonya check no because science ni nyina no na esese obi prostatitis an kolite minya no a obetimi odwonso a ne be ma betimi aye ne ya obi so cancer ono so odwonso a ne be ma betimi aye ne ya obi odwonso a obetimi ate pains e wo be menem so hu ena obi o enlargement no so obetimi anya almost the same thing obi o enlargement ya bo se mpem bire no ano ema prostate no enlargement no enlarge outside and the outermost part no and enlarge back within the innermost part no adena you say I say donut no it in the kase no bo say a boba inside a mom mabonten won say ka de bia kase anka bo say a blotiba outside say but then the no prostate in there a blotiba inside no it a blotiba inside no sa no na ema ujuwitra no a nam prostate mu na e kanetwom na e kanetwom sa no dwonso a bo so obi ha bo so wo chem obi or cancer no so the same thing obetimi odwonso abon say ono so chem because em sika no once your cancer na sha ase no na say other organs which say urethra no and a bladder no na say bladder no so ninti no na bo say na odwonso tentem because bladder no the also say ne the say the storage system as a reservoir nipa de say ni kidneys no a produce ayifi a chimfi afri honamdua no nyina no e free kidney ni mu no a efa bibi efa say urethra na aba be gu bibi efa say bladder nim na be gu bladder nim a bladder no is supposed to store the urine. No obi or cancer na say any of the prostate disorders any bi no na the esi ni say ono de begum sa no a ontimi store nche ye begum no ano na also empty na why empty kura wie no na ofelice dwonso no esa ade de biem science ni bi no obi so okra na wadwonso no say ya wo ko gina kwa say ya dwonso no beba eno so kwa ya asem dwonso no bo so wagina won kwa na say dwonso no ase beba ase ma e twa na dribblings so hu na dwonso no ase be beba etu betuma gina wa ansa na dwonso na ye dey aba obi wo wie mpokura no so no bo say dwonso no eba in a drop platforms eba ko na koko no eno kwa betuma mo wagina ho be 2-3 minutes because se wo force na oje ho atinyi now the entwanwie na de hyɛ wo de hyɛ wo panty mu a obawie na wasɛ wo honam nyinaa wasɛ wo panty mu asɛ wo bibia
enti nansen krofo mo adult diaper no
edoso pa Nana doso papa enti se market ni
se meton diaper ntim dem
okay
enti reasons ni bi no
obi okwa no functions dia maye yi ni se function okay bi a occasion bi a wo ye panyin so wo ye panyin na wo sa problem ni bia e bia wontimi ntena se better 30 minutes amekwa wo nwonso enti no si abo occasion abo ayi bi wo program bi ase na panyin wo be ma speech bi a wo be so de akase me kwadwonso aba wo program na ase enye yi enti no eje se de also ya no se je se obo sa pampers ni bi wo ji wo ye mistake ya obadwonso agun ho wa joso no so e ka wa se ko bia joso ka no a se prostate ni problem a nana de joso ka wa wo so utimi e de hye won kakra but se prostate ni problem a utimi fa hye won ho e ka no na because se cancer so a e affect your bladder no so no get affected enti storage system no ase no the car no also utimi do amika ekwadwonso and e ma odwonso 10 polymutation obitimi just be 5 to 10 times asana ade ache na usually no the ma Johnson next time me say be madam be frame be din komo aba bibia kan say polymutation say ya be hunu say wo Johnson na wo Johnson be biri no won ko ye test kra na obitimi nya science be suspect say we dey diabetes na this ade ne ba be suspect say me Johnson be biri no ye kidney this ade ne ba be suspect Johnson be biri no ye cystitis na de ba ana say me brother na ye weak be suspect say me dey be biri no if you prostate ni mu prostate one no nana the tade ba kese pa no say etama anajo ye baka say nocturia ana say anajo Johnson so wo so da Johnson frequently especially happens in the night because the only person say your hormone bi why baka say antidiuretic hormone na sa hormone no the ya say anybody say ni wada no e release na I give the kidneys no a pause it give kidney a pause no a that time no emma said yanka at the rate ya ka kidney no eya adwuma achim efia firi hunam dua nim amana ba abonte ama adwonso no na amanda nti obi betuma atuma da be 6 hours ye dem bi say it mi da be 6 hours ye so de kra nwonso kra supposed it ni strong wa obetuma da na ho 6 to 8 hours non stop unya so le ye no ano na sa anti na aide asoppress na kidney na say eje na dwuma yie pa say de o say ye fa no but wo prostate problem no a sa this type of hormone no say antidiuretic hormone no nana e break it down and into wo de no say ka be ma pause no entimi ma pause no ta na dwo no twmu tan e be say wona wo so wo da na no aye wo de no a bo so wo so de so dwonso and into abo se bebiri kura bi mutimi dwonso gu omo as a result of that. Now anam say prostate no urethra no e kan prostate ne kan urethra na twum ninti no ojonso a wo chem wo strain you strain before you urinate wo obajonso wo chem na wo chem sa no so no na ma Johnson e ba na split obu okwa na wotimo nya retention Johnson no e ma wa Johnson a wuti say Johnson bi aka eso so wontimi empty wo bladder no so ehun sunsan so no abeduru baby no na wo se waya ase eya wo ya abdominal pains wo hips ni nyina no na so asase se eya wo ya enti obu okwa de to kwan edenti na those days pa no na scan machines in my ne yin so urologist e pese wo check ehun prostate no a o she gloves no de nsa ahya wo to kwan no obo se prostate no eti obo so obe feel the prostate no e wo to kwan no obe feel enti o feel abo so ayekese a obo so ayekese but enena de hospital bi no yesa de no ene wo de machine si wa na no ayeyi na with time no e yesa no ano na wo sexually no ansa no sexual performance no eno fa say e ba form
na ye ya no bi attest busa say busa doctor ma me say 3 years ni men have sex na e be ha me ana
yo dana ade ba ko a eboa mema e mo bo prostate ho ban ya ade a e be kan say sexual intercourse on say medically no na ka say when you stop using a part of your body for the purpose for which it was meant for no you lose that part the part nyina na say yakobon honam dua na waba mo ye nyina no se ujai sa part no no amfa anye the purpose and adwumadi a wo se wo de ye no a wo belusu eno nti no nana sa wo hwe mo se ya newscasters ene mo a or multi memorize a lot of things ebia mo betena say mo ka news no a ya na bebre sama ma ha na minim say fofofo but say mo news yi kura no ya twa no brofo and now when you boss no so to be translate ebetwi nana edin say kameye English newscaster kameye twi die no edin papa eti you need to be highly intelligent before when you be boss because I don't know a script any actual news ni na when you boss no translate that English to when akona adwen na ye sharp
tanya ya what studio kind na yes breaking news near dia bro
na
I know they will reading it through English. No,
now what translate. So you need to be fast. I don't see omo amonte sa no. And I say wo hwe omo a omo sua de. Wo de hwe lawyers ya lawyer Mpom. Now hwe lawyer Chechuchi kata. Hwe mpanyifo wo do banyini. Na kampanyi de e ka wo nyini na ka wadwen no kwa wo lusu brain no. But they are learned. They are all the time they are learning. Eti adwen no highly active. Meaning that they have not stopped learning. Now what am I say? So they are not losing the brain. So set people ombetmenya be obetma obikwa bedu mebe ontimi sore enante. But ubusa ni history bia no a obetma ma from Kwame before Kwame Nkrumah the bond of the end there obetma ma ni nyina mrofo ne ba nyina obetma ma wa besi present obetma ma sa there because they are still learning. Meaning that they are using their brain. Nana say do mempempe so bi o abrabom na say wo ye wadwen say wo nante a ana say wo de wa ye na wo tika mu wo te wo partner ka mu over a period of time na wo nante nana bedu mebi no ya ka say free ha say na ko ebi amojansen su a bedu wo no na o pante you are not we have stopped using that part wakoma no endurance level akọ down nante working skills and to be also or nante kakra bi abo na no na ekatwi
we are nantante some dey akọ be ka twa mo
anything you have stopped enti ade ba ko a me ka ma maka say tintin nyina no say prostate na ade ba ko a opanyin a ema unya cancer wadu mpanyin fie so a we are not promoting say also bia empanyifo because empanyifo na wunyini no na prostate no so wunyini anything dey obka say wo panyin a that time no ehia say ono wo yere edai etahia mo hia sa no a ebo prostate no ban against BBFN say enlargement and abia cancer nemo no eno no nche say bia go about sleeping so we sleepy with different people no so and so emma wo so the chance of getting infections so no is extremely high and so bet makofa bibia can say prostatitis no so no e mema sa san bia wo so abema mu ye oya na moja di akire na nsuo fitafi be mani mu ba wo be chema sana jonso na ba na obema no kwasha se e fon penal atrophy obi o ha bon say sexually ni kura no obi o tanya infection bia no na bedu mebi no ne be ma no kwa emfansen emma wo sexual performance testosterone level no e breaking down emma ho den kura o maso a edinti no we are not saying say you should go about sleeping with a lot of people but o partner no nana ade ba kwa e bo ho ban because wo yes sex no ye fe be dilation and constriction e constricted so ho se prostate no be bia e dilate e bie na ye dey wo wie no ana enti e ka moa na bie e ka moa na enti e exercise for the prostate gland
kanu amfa ko yanketwa de o na de ko yanketwa da ba ji wani su bia hard on
and it is another one you see over a period of time no there's a research here say e betimi promote enti wo form a omo nye sex kra e na omo ye sex no so obi o ye sex no say nya infection o konya the prostate no didi ye exercise nya no nko na de ba nya no nko a wo yes anoma we nyina kana wo ye regular checks no a bo ho ban from say with manya enlargement or even cancer.
Bible crack and say ma yiri mpoku anso weni da.
That's right.
It is rank yanketwa de. But yesterday mama na aboafo asembra sesi a.
Peace FM.
Said you obetumi a check na farmer APC nsonti and why ye ne sa akoma.
Uti paiwa fakina farmer akuma APC.
Kaka hawa
akuma APC. Sisiare waposunu no mpemu na ya oya. Fever ana wonam ya. Emu bia kina farmer akuma APC ebeye firi ho. Nemum nanuachi na enkoi dia kuhu doctor kina farmer akuma APC eyema obia ya wadi emfiedunsia 16 years dekro.
Hey, catch it. List ni nie. And you ma beto to dia me baba no hwade no. Hwem so betumi a. Now beka. Ya John to mami ensa duku portmanteau. This way chocolate drink. Na kan wo hwe afibia so beri ni waware ni a. This way chocolate drink. Na kan sia. We dan kwanu ntumu ho. Me be mo anu nso hye kura dia ka ho. Wo hade wapi ho. O ka sabatete e da fom ho. This way chocolate drink.
Kra cha be pe baba ware yi. Ye fi say this way chocolate drink ya sorry anopa no ne yenom ye bi hye fridge nom no se snack ye nya hoho a no ne de serve wo mo ye didi wie ne ye pe bibia bogu ya de so a this way chocolate drink ne yenom and this way no ti ano a he se kire wom kokko wom brick wom bibia wom ade wo hia ne so hye
this way chocolate drink
je wo hia ani so hye
FDA ahwehwe se adwede nkratoe mu agye atum se eye. Okay, my human channel, who say brand ya bit na ye na yetimi ene no ato Dog ye brand so, but a foot to be na de bema o mama. E de afa cancer ni nyina ni titru e memma e prostate e de eho.
Yo nana medase o se tia se ene wiase no ye nyini de o se tia se yade no new yade your lifestyle I wo wiase COVID-19 say ye hu the course no but ebedun mebi no science be ko nanimu a research e course wi de ebedun mebi betuma kire de ntia de say yade ne baaye enti environment no esesa no na yade so eye dey eba enti yen esi suo kakra no yen wo yen ebi mo ewo m bia late 70s and 80s no na ye beto ye no ye meto say yade bi kura wa fe na hepatitis ni enim yade bi fe ni say HIV na bi ni ho but ene edey ewo ho eninti emere changes ya eba ewiase no e de yade bibiri so and technology no once ya yenya advancement in technology they also who say yade so eba no so no e sophisticated yade first na we biti akurase ya sa sophisticated yade no maybe in those days no na any being said anko so no na yenya sa anama no because exposure to radiation is anama ni nyina no na bibia ni was because machines here phone you can be ni ho and obi akwa use ni nyina no mete race and sa anama ni nnuane edie fertilizers ye wo ho ya ye di sa nnuane ni nyina no wo junsan so tinana de ebetimi aye aboye ho ban ne se enne no obia no emfa ono ano esebre ense ono ano nsem sade COVID-19 abaye a ye se obia nse nose mask ya omo amaso te asem de omo hyeyi no sada na ye se tu omo fo se COVID-19 aba no nche se ada yade ni nyina no omo abo mu tirase no enti yenhwe se ada yade no COVID-19 ba beto ada yade bi su ho na sa yade no so kwan be ne ye fa so a ye de ye bo ye ho ban against ayade no na kwan ba ko e betima fa so a e betima bo ye ho ban e wo sa prostate cancer ye ka ho asemi nyina ne se nana onipa a wo tie mi bia no emomode anse obetime tu anamo akọ ayaresabia se wo ba ye ho a eye endpoint dia nana ye kra de ye free scanning yes scan na a person be check prostate say prostatitis, prostate enlargement, prostate abscess or cancer no scan no we are doing it for free. Lab no na obetua lab no ye 150 Ghana obetua o card so no oba ho folder 40 cedis ene ye de ye na mom no hospital onya ho na beba kora no akwalibu ho regi ho obetuma ko nyina na waye de anye kora no afi bia no utimi kokoye sa de wi ya nana yade ba ko a wo ahye ho se yade no anye kura no se obi ekoye na afi na se eni bi ebi ni ho na me fanse bia 3-4 months time se eyi ni ho adi mpo no a na si okocheke a obehun se enkodru sa stage 4 no a ede eba behwere ne nkwa no and you know the surest way I timid boy ho ban against cancer all forms of cancer no regular check cervical cancer the same thing yamomodian breast cancer yamomodian say breast screening ni cervical screening ni nyina no ayena ayasabe bebre no ano okwa omu nyina ayesade no the surest way na akọ na bi ni ho a doctor na betimi atwetwe nkomo na wa kire wo normal wo ya ebe dai ebe bon ho ban against ade no na 90 wote say obi a wo tire screening e wo cancer wote say e bo cancer wo bebere no a e ma wo yam hihye wo bebere na wo a wo nya bi da no de bia you are guilty of that sayade no we ni ade a am say me de be ma Ghana fo nyina if say nana e na wo nam kwan wo na wo say de nipa esi wu no a se bi si fi a nana wonte ase enti ye moya nkwa ho e ban eno ni ade a am say de be ka che Ghana fo nyina
awie me dasi o
nana aseda Nyankopon dia
me dasi abso for any Dr. Duboatin Dr. Penimpo war end point homeopathic clinic and a bar ebedi enkomo ena wie yi ye hyase ene Luca Health for ene kasa ye ye ne Dr. Jeanette Bakshat ene hyase di nkomo ene ne Dr. Duboatin aba bewie Dr. Duboatin ene Dr. Penimpo war end point ene ono aba abewie asembisa bia ka kire no ma number na wa Fred Dr. Boatin also 0244 867068 0244 867068 and a 0274 23 43 21 0274 23 43 21 mama numbers 2 baako 0244 867068 and baako 0274 234321 medase no bre sacrifice am much na no pa bibia nsesa ye be sha wo neat fitiam nkomo so ye be ba be di ye ho nkomo etinyambo ochina no pa me nhia na hwe wadaagye yie na hwe apomudin yie hwe ba bia wo bewura bia nso yie na bomodin du hu ni hohoro won sabra no hwe wo nose mask no na de esefata ya covid protocols no udi so a enyame adom a obede wo ho medase awie Peter Square Michael Jerson Mane Arafat Pretty Joyce Mami Biama Kofo ena Akosia Sapon ena hihye dwumede mami bedi ho chiame medin Nana Yaa Konadu kila abobonua odi an kind na ba Mr. Street Light Mr. On the Street Light now odi an kind din for Fred Yama no fi ha no Mr. On the Street Light now ono ana me sorry woba ono ba wa street lights no ho asem cars na pempem dodo no e de hwehwehwe na jono dodo no street lights na ni hona bill na ye tua ne nso so de street light levy e hyeso mojesa since street lights no enso enti Mr. On the Street Light now obeba campaign is setie biara e ka ho medase nyame shaw on shaw so ommo ho ban a ho masem na wade ye bia enye ye ohima mesne de epon bakram me babetina me mo
What you